streaming live on YouTube. I will just verify that. And I believe we will be live in YouTube in the next approximately 10 seconds. All right. So we are live on YouTube. So I welcome each and every one of you on this entire topic, which is going to be predominantly on abnormal vaginal discharge. Now, remember, in our last situation, okay, in our last entire lecture, which we had on vaginal discharge, we tried to understand what is the way in which the vaginal discharge actually occurs. That is what we tried to understand. And I think that is very, very important for all of you to go through it, because what happens is when you follow this entire thing, basically you will get a beautiful idea on what type of discharge are we supposed to call as an abnormal vaginal discharge. And I think that is very, very important. So let me again start the screen sharing for all of you. In this screen sharing, you will be able to see my screen. So let me go to the notes again. And let me try and get a new note. Here we go. So here we have a new note with us already. Okay. And remember one thing about vaginal discharge. So whenever I write vaginal discharge, I think today we are only going to be talking of what is abnormal. Okay. So now remember, as we said last time as well, there could be a multitude of things which happen as far as a pregnancy is concerned. There could be a multitude of other factors which happen. Okay. But predominantly, when you are looking at the vagina and vaginal discharge, you must remember that this is going to be the cervix, and above the cervix is going to be the uterus, and then there is going to be the endometrium. So I will just label this as the cervix. I will label this as the vagina. Remember, whenever we talk of abnormal discharge, okay, one thing which is extremely important to note is that it is increased in quantity. This is very important. Second, what is very important for all of us to note and to understand is that it could be associated with a foul smell. The third thing, which is very important and which we must all note in such a situations, is that it could be associated with other forms of infections. That means it could be a yeast or a fungal infection. As we know, it could be a bacterial infection that is very common. Okay. The fourth thing which we must all realize as far as abnormal vaginal discharge is concerned, at quite a lot of times, it could also be an allergic reaction. This is something which is very, very important for all of you to note and to realize. Okay. The fifth thing which is important is that it could be due to postmenopause. This is very common that a postmenopausal lady has abnormal vaginal discharge, and in such situations, always try to rule out cancer of the cervix and cancer of the endometrium. These are very, very important points for a physician. Okay. And the sixth thing, which is important, especially in today's situation, is any state which is causing immunosuppression. Okay. All these things, right from point number 1 to point number 6, can cause multiple types of abnormal vaginal discharge. And that is something which we have to always keep in mind. Now, in order to identify what and how should you be treating this vaginal discharge, remember the method of treating this vaginal discharge is going to be very, very simple. You are not supposed to give random medications. You take this antibiotic and get treated. This is a very important take home point, especially for people who are family physicians. Note down that you have to put a cusco speculum and examine this cervix. So the most important point is examination, clinical examination. I always believe that this is something which very, 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 very few family physicians do. They randomly treat the patient. The most important thing which you will do in this situation is examination of cervix and vagina. This is how normally a cervix would look like. This is going to be the external os, okay? And this is going to be the cervix, all right? Now, behind this is going to be the fornix. So this part is the fornix of the vagina. Okay, fornix of vagina. I will just label it upstairs also. See this? This is called as the fornix of the vagina. This. Okay, so there are four fornices, lateral two and anterior one, fornices of the vagina. Now remember, this is the region, fornix of the vagina and the cervix. It is this region where you are supposed to identify and look for the type of discharge which is happening. I believe there can be certain patients and there can be certain family physicians as well who are not very comfortable. You know, these are people who are not at all very comfortable as far as examining the patient is concerned, and quite a lot of time patients are also not very agreeing to do the examination. But please note down this point that you should never treat an abnormal discharge, vaginal discharge, without examination of the cervix and the vagina. This has to be documented down by all of you. Quite a lot of times the commonest thing which is seen is this. See, if I draw the cervix as this way, the external os is going to be very haphazard and there are going to be patches of inflammation and infection. This we normally call in our local language as cervical erosion. This is something which commonly happens due to an HPV, that is human papilloma virus infection. And this is something which can cause a heavy vaginal discharge. Quite a lot of times, this can be identified only by doing examination, supplementing the examination with something which is so important, which is called as the pap smear. And because it is so important, I'm writing it down this way and I'm circling it with red. Remember, as family physicians, this is something which you must do. When you have a cervix like this, you must take a pap smear. There is absolutely no way in which you should do this entire thing without taking a pap smear. All right, you must take a pap smear, and that is something that you should learn and realize. Okay, pap smear is something which is commonly available and commonly tested, does not require any major setup, and I believe testing of the pap smear is not going to cost you more than 1,000 rupees. So that is something which has to be done. Should you find something abnormal in the pap smear report, it should be supplemented with a colposcopy. But then colposcopy is not a part of the family physician's arena. And as a result of this, I'm not discussing anything about colposcopy today. Now, after this most common cause has been documented and studied, the second most important thing is to please rule out infection. And in our country, the most common cause of infection is going to be bacterial vaginosis. Okay, very common cause. Second most common cause is going to be a fungal infection. Now, bacterial vaginosis can be caused by a lot of bacteria as well as parasitics like Trichomonas, Gardnerella, all these things, okay, they can cause this particular infection. But we must remember that if you remember one golden line, no, bacterial vaginosis, okay, the treatment of choice is going to be starting with metronidazole. So it is either going to be metronidazole plus secnidazole, or I mean metronidazole or secnidazole or tinidazole or whatever. They are very effective in treating bacterial vaginosis. And when we are talking of fungal infection, the treatment of choice is going to be antifungal agents like clotrimazole or itraconazole or fluconazole. Remember, the only two things important about fluconazole and itraconazole and ketoconazole is they are not usually recommended in pregnancy. But again, as a family physician, the first thing you should remember is that when you are suspecting an infection, which is predominantly going to be characterized with a foul smelling discharge, at that time, one of the most important things that you should be doing is you should be taking a high vaginal swab. Okay, I believe none of you do this. I believe this is not a common practice, and the commonest excuse which people make is, "Arey, patient nahi sunta hai, sir. Patient does not want to do this." So that is not the right answer. How a high vaginal swab should be taken from the fornicial aspect, both the fornices, and it should be sent for culture, and you should treat the patient accordingly. There is absolutely no other manner in treating the patient. The third thing which you should remember is that, remember, irrespective of what you do, always add a probiotic to your medical combination. Addition of probiotic helps in restoring the lactobacilli of the vagina and it also helps in maintaining a good pH. There are a lot of herbal agents which are available which help in maintaining the pH. We all know these are various forms of washes which are available, which are predominantly pH specific, and these pH specific further help in the growth of lactobacillus in the vagina, and the lactobacillus in the vagina can also be supplemented with probiotics which further reduce vaginal infection recurrence. Okay, that is something which you must all understand. So please make it a combination that if you are giving antibiotics, you also give probiotics along with this, because addition of probiotics to this is going to really benefit your patient. I will be talking about the allergic reactions, and I will be talking about the immunosuppressive treatment which can be done in my next session, which is going to follow this entire session. So currently I'm stopping the screen sharing here, and I will go back uh, to the normal chat mode. You must also understand that the take home point for this should be that family physicians must learn to do pap smear. Family physician must learn to do cervical examination. They must invest in cervical examination sets. It is a simple Cusco speculum which is available so easily to treat your patients and to have a look at this entire situation. Please do not, please do not treat these patients randomly. The minute you treat them randomly, you are exposing themselves to two things. One is a very high chance of recurrence, and second is antibiotic resistance. Remember, a patient is going to change the family physician if there is a recurrence. It is very simple. They are not going to stick to you. And the only way you can avoid this recurrence is when you begin to treat these patients very correctly. I believe that should be a very important take home point. Do pap smears, do cervical examination, take a very good history. These three things are going to differentiate you from the rest of the family physicians, and you will be able to treat your patients with abnormal vaginal discharge much more effectively than what you are currently treating. I thank you very much for joining this session. We'll come back with our